Welcome to Channel 12 News. I am Audrey Monty.
And I'm Celine Young.
And we are Canada's #1 news team. Tonight, in light of the unfortunate shutdown of the American government on October 1st, we will be bringing you all the information about our healthcare system.
Canada's healthcare system provides coverage to all of our citizens with both public and private insurance options.
All Canadian citizens qualify for healthcare coverage regardless of medical history or income. The public system is funded by the people's taxes and is managed on a provincial and territorial basis, following the guidelines set by the government. There are about 30,000 primary care doctors here at this time, and they provide basic medical treatment and preventative care. But Canada's public health care doesn't cover everything.
Private healthcare coverage can help cover the things that the public healthcare leaves out, such as dental service, optometrists, and prescription medications. Private healthcare insurance plans are usually offered in employee benefit package, but you can also purchase it.
But there is an advantage to private clinics.
Yes, if you do go to a private clinic, your wait time to be seen and helped is significantly shorter than if you were to go to a public clinic.
The wait time to be seen and treated at public clinics worries some people, and they are interested in switching to a completely private system like the United States has. But at the same time, they are also worried about the inequalities that will arise in the system, since the wealthy will be able to afford better treatments.
But thanks to the Canada Health Act, no one can be denied service due to a pre-existing condition or financial inability. The Canada Health Act is federal legislation that puts in place conditions by which individual provinces and territories in Canada may receive funding for healthcare services.
The 5 main principles in the Act are: all administration of provincial health insurance must be carried out by a public authority on a non-profit basis. They also must be accountable to the province or territory, and their records and accounts are subject to audits.
All necessary health services, including hospitals, physicians, and surgical dentists, may be insured.
All insured residents are entitled to the same level of health care.
A resident that moves into a different province or territory is still entitled to coverage from their home province during a minimum waiting period. This also applies to residents which leave the country.
And all insured persons have a reasonable access to healthcare facilities, and all healthcare providers must be provided with a reasonable compensation for the services they provide.
We have a reporter out interviewing people on the street about their opinions on our healthcare systems. Now we go live to Vanessa Anderson in Toronto. Hello, Vanessa.
Hello, Celine. I'm in Toronto right now reporting for Channel 12 News with Alex Jabotsky. Tell me, Alex, what do you think of Canada's healthcare system?
I find it very convenient, especially with our card.
And can you explain these cards to me?
Sure. So in order to gain access to Canada's healthcare system, you have to have professional health coverage. So Canada's Healthcare Act requires everyone to be accepted for the health coverage. So everyone gets a card.
And what do these cards do?
So the card is used every time the holder visits their healthcare provider. There's an identification number on every person's card. That number is used to access their medical information.
Well, and you would say you approve of our healthcare system with the cards.
Oh yes, I love it. Like, I had my friend who was terribly sick, but with the Canada's Healthcare Act, he got taken care of, and it was great.
Oh, that's wonderful. Well, thank you for talking with us.
Thank you.
Going to go to a live stream of someone you may recognize, former Canadian pop star Robin Sparkles. As you know, Robin moved to America not too long after her song P.S. I Love You came out. After being in America for so long, she has developed some very interesting views about our healthcare system versus that of the U.S. Would you like to tell the people at home about your thoughts?
The difference between the American healthcare system and the Canadian healthcare system is that in Canada, people aren't scared to go to the doctor, so they don't get these huge infections or huge diseases, and then there are less people who are sick. But in America, people are scared because the healthcare prices are so high.
What interesting insight. Well, thank you for talking to us, Robin. Back to you, Audrey.
Thank you, Vanessa. That's all for today. See you tomorrow.
And good night.
This is Channel 12 News, Canada's #1 news team.